Okay, we've all been there. You're standing in the pharmacy, staring at that wall of painkiller boxes. Tylenol, Advil, Motrin, they all promise to make the pain go away. But are they really all the same? Nope, not even close.
So how do you pick? It can feel like a total guessing game. Do you just grab the brand you know? Or maybe the one that's on sale? Well, the truth is, picking the right one can make a huge difference. And picking the wrong one? Yeah, that can even be a little risky.
But what if I told you that the entire choice really just boils down to one simple question? Is your pain actually being caused by inflammation? Seriously, understanding this one word is the key to everything.
So, let's get right into it. To really get this, you have to know that these medicines take two completely different roads to stop your pain.
First up, you've got your analgesics. The main player here is Tylenol, or its generic name, acetaminophen. Its job is pretty simple. It relieves pain, and it brings down a fever. But, and this is super important, it doesn't really do anything for inflammation. Think of it as a pure pain blocker. Then you've got the other team, the NSAIDs. That stands for non-steroidal anti-inflammatory drugs. This is where ibuprofen and diclofenac hang out. And their whole strategy is different. They relieve pain by going after inflammation directly at the source of the problem.
So, how do they actually pull this off inside your body?
This is where it gets pretty cool. Here's a really easy way to picture it. Tylenol works up in your brain's control room. It doesn't travel to your sprained ankle. It just tells your brain to turn the volume down on those pain signals. NSAIDs, though, they're like firefighters. They rush right to the injury to put out the actual fire, the inflammation itself.
Let's get a closer look at what those firefighters are doing. So when you get hurt, your body releases these little chemical messengers called prostaglandins. They're the culprits causing the pain and the swelling. What NSAIDs do is they block the stuff that makes those prostaglandins. So no prostaglandins, no pain and swelling. It stops the problem right where it starts.
Okay, so we've got the how, but now for the part that really matters. Which one of these is the best fit for you? All right, when should you reach for the Tylenol? Well, it's perfect for pain where inflammation isn't really the issue. Think a standard headache or a fever. It's also the safest bet for people with certain conditions like stomach ulcers or heart problems, and it's generally considered the safest pain reliever you can take during pregnancy.
Now, what about ibuprofen? This is your go-to when you can clearly see or feel swelling. We're talking about a sprained ankle, bad menstrual cramps, or that throbbing pain after you've been to the dentist. All of those things are driven by inflammation, and that's exactly what ibuprofen is designed to fight.
And then we have diclofenac. This one's the heavy hitter of the group. It's prescription only for a really good reason. It's usually saved for severe, ongoing inflammatory pain, like arthritis, especially when other options just aren't doing the job. This is one you should only ever take if your doctor says so, and they're keeping an eye on you.
But it's not just about power. It's also about safety. Each of these drugs comes with its own set of risks, and you absolutely have to know what they are.
You can see there's a pretty clear trade-off here. Tylenol is easy on your stomach and heart. The big risk with Tylenol is for your liver, but that's really only a problem if you take way too much. So never ever exceed the recommended dose. Ibuprofen and diclofenac, on the other hand, can be tough on your stomach, kidneys, and heart. And you can see that risk really jumps up when you go from ibuprofen to the much stronger diclofenac.
So here is the bottom line on safety. That extra inflammation-fighting power you get with diclofenac comes with the highest risk to your heart of all the common NSAIDs. That is why you need a prescription. It's not something to mess around with.
Phew, okay, that was a lot. So let's put it all together in one simple, easy-to-read cheat sheet.
This should make everything crystal clear.
Look at this. You can really see the trade-offs now. If you need something that's easy on the stomach and heart, Tylenol is your answer. Just remember, no anti-inflammatory power. If you need to knock out some swelling, ibuprofen is a fantastic over-the-counter choice, but you've got to be mindful of those moderate risks. And for that serious prescription-level power, you've got diclofenac, but it comes with that high-risk profile.
You know, at the end of the day, it all comes down to this. There is no single best painkiller that works for everybody. The absolute safest and best choice is always the one that's tailored to your body, your health, and the specific kind of pain you're feeling.
So the next time you find yourself in that pharmacy aisle, you're not just guessing anymore. You can look at the boxes and ask the right question. What does my pain really need? Is it just pain, or is it inflammation too? Now you've got the tools to choose wisely.